Sleep apnea is a serious sleep disorder that involves the soft tissue within the mouth that starts to block the airway. When we sleep, our lower jaw and tongue falls back towards the throat, and this starts to be obstructive. This causes patients to have temporary pause in their breathing pattern while sleeping. Some telltale signs of sleep apnea include excessive exhaustion or daytime sleepiness despite sleeping all through the night, constant headaches, memory fog, cognition problems, as well as dry mouth. We tend to believe that this is an older generation issue, but it's not true. You can have sleep apnea in both children and in adults of all ages. Children tend to get misdiagnosed as ADD or ADHD as they display similar behavioral issues. It is very important to do a sleep study even on children to determine it is not a symptom caused by sleep apnea, which is treatable. A lot of times the obstruction that's caused by large tonsils, adenoids, severe allergies, respiratory issues can be responsible for this. As soon as this issue is identified, referral is made to the ENT or an allergy immunologist specialist. If we suspect that a patient has sleep apnea, a sleep study should be done for the medical diagnosis. We can do it here right at the office, and the sleep study can be interpreted by an MD physician. You can also do it with your sleep doctor. At the sleep center, they use a polysomnogram, which records eye movement, blood pressure, heart rate, brain activity, and oxygen levels throughout the night. The person sleeps at the facility and is watched by nurses or a technician throughout the night. Most patients prefer home study that we provide. It is easy to use, and you can do it in the comforts of your own home. The next day, you simply drop it off and we have it interpreted for you. The study is crucial in detecting and diagnosing obstructive sleep apnea, also known as OSA. Once detected, multiple treatment options are available to improve a person's ability to sleep soundly and comfortably. It improves their health and their life. At my practice, we also do a CBCT scan to check for narrowing of the airway spaces. This allows us to see if the soft tissue is obstructing the airway. It is a great screening tool and lets the patient visualize what their airway looks like. It also lets us check for deviated nasal septum, anatomic restrictions, sinus issues due to allergies, and we refer them to specialists accordingly. There are several treatments available for sleep apnea that includes both lifestyle changes as well as medical procedures, devices, and dental appliances. The gold standard for treatment for obstructive sleep apnea is CPAP, but many people are intolerant to it because it causes claustrophobia or being tied down to a machine or having to travel with it everywhere. These are just a few of the complaints, and there are more. So the dental world came up with a different appliance, and that gives a patient options of retrieving their airway space, which allows them to breathe again in the night without pausing. We offer these dental appliances here. Some of the other treatment options include laser surgery to tighten the soft tissues at the back of the mouth, surgeries that include removal of adenoids, tonsils, and also contouring of the palate. We can also have lifestyle changes, which includes weight loss, smoking cessation, avoiding alcohol, managing allergies. You can ask your doctor what is the best treatment for your current condition.